Hello everyone, this is Dr. Shruti and Alex, Assistant Professor in the Department of Biomedical Engineering. And today we'll be looking at a specific topic in tissue engineering and regenerative medicine taken from the Unit-4 Ectoderm-Derived organs. So we'll be looking at the first part, which is the regeneration of hair and nail. So, first coming to the general introduction on tissue regeneration. So, this is the process by which cells and tissues regenerate and they basically renew and restore themselves. So, let's say there is a injury, the old cells have to be replaced. This plays a crucial role in wound healing and regenerative medicine. And why is this important? Because understanding the mechanisms that are generally involved in the cell cycle will help us to plan for better treatments for injuries and various degenerative diseases too. And the key aspects covered here in this lecture would only be the first one, hair regeneration. So first coming to the hair growth cycle. So this is a continuous process that determines how the hair grows, rests, and eventually falls out. It consists of four main phases. So the first phase is the anagen phase or the growth phase. So here the cells are in a very active mode of regeneration, and the hair follicles are actively producing new hair cells, and this is leading to the hair growth. So majority of the hair, around 85 to 90% of the hair in the scalp are always in this phase at most of the time. And so during this phase, the other things that are noted are there is active proliferation of the other cells like keratinocytes, melanocytes. So keratinocytes are the cells that are producing the keratin, which is the main protein that is forming your hair. And then you have the melanocytes, which is giving rise to the melanin pigment. So that is what is giving the hair the specific shade of color. And this entire anagen phase generally lasts for around 2 to 7 years for each hair follicle, whereas the this duration would vary based on the genetics. So for different lineage of people, you have different duration of the cycle, and also based on the body location. So certain like body hair will have variation in the anagen phase. So next coming to the okay, this is the hair growth cycle phase, wherein you have first the anagen phase. So this in this phase, if you can see, the hair is basically attached to the follicle. It is getting good supply from the blood vessels, and this is enabling the growth factors to reach the hair cells, and thereby it is in a active growth phase. And next phase is the catagen phase, which is the transition phase. So in this phase the hair hasn't completely stopped growing, but it is proceeding towards that. So basically, slowly the hair growth is stopping, and the hair follicle starts to shrink, and the hair is detaching from the blood supply. So in this phase, basically, there is also a cessation of the melanin production or the color production. So this phase usually lasts for around 2 to 3 weeks, and around 1 to 3% of the hair are always in this phase. So here you can see that the hair follicle has started shrinking, and it has moved out. It is slowly trying to move out from the blood, and it is detaching itself from the blood vessels. So next phase is the telogen phase. In the telogen phase, the hair is still attached to the hair follicle, but this what to say, in this case the hair growth has completely stopped, and you have around 3 to 5 months of the telogen phase in general, and this helps the follicle to basically prepare for the next new phase of the anagen. So and yeah, so eventually in the next phase the hair will be shed out. So we can see that around 10 to 15 percentage of the hair is generally in this phase of the cycle. The last phase, which is the excision phase, is the shedding phase. So the old hair will fall out, and what to say, the normal, normally around 50 to 100 hairs are generally shed per day. So we might imagine, certain time, we see, that, daily our hair fall is, higher. So you don't have to worry. The normal, rate at which the hair falls is around 50 to 100. So probably if it is slightly more than that, you have to probably consult a doctor. So yeah, so during the excision phase, we can see that the hair is being shed out. Simultaneously, the new hair also starts growing uh, from the stem cells. And yeah, so this basically overlaps with the telogen phase, and the shedding will occur over weeks to months. And thereby, because you have the new hair coming up, so this will again give rise to the next hair growth cycle. So what are the factors affecting the hair growth cycle? So you have genetics, which is the primary determinant of the cell cycle length. So, or the hair growth cycle length. So basically, certain people are generally they have better hair quality, smoother texture, different colors. So all this is also played majorly by the genetics. And then based on age, so younger people will have a longer anagen phase, and yeah, let's say when as they age, they will tend to have a longer telogen phase. And if you're looking at hormonal changes, so production of androgen, thyroid hormone, pregnancy hormone, etc., especially postpartum changes, these can influence how the hair growth happens. So people usually notice post pregnancy there's a lot of hair fall or certain changes in the hair growth cycle. Apart from that, nutrition also plays a major role. If you have deficiencies in iron, biotin, protein, zinc, and vitamin, this can also disrupt the cycle. Another major role is played by the stress. So the stress can be either physical, overexhaustion from your daily physical work, or it could be emotional stress or trauma, etc. So basically, all these will increase the reactive oxygen species in your body, and that can push your hair into telogen phase prematurely. So even though the anagen phase is going on, because of the production of these reactive oxygen species, so this can cause the telogen phase to enter faster into the growth cycle. Apart from this, health conditions like alopecia, scalp infections, autoimmune diseases, they also play a major role. Medications and treatment like chemotherapy, certain drugs can also influence the hair growth cycle. So we have certain conditions like telogen effluvium, so excessive shedding due to stress, illness, or hormonal changes. And then you have androgenetic alopecia. Basically, in men, there's what to say, there's balding that is observed, which can be given the term androgenetic alopecia. So genetic hair thinning due to shortened anagen phases. So that is another condition that is observed. Anagen effluvium, which is sudden hair loss due to certain chemotherapeutic drugs. So in all these cases, since hair adds beauty to the person, basically, so when there is a lot of products are evolving which helps to support hair loss or hair graying, etc., it is very important to understand the hair growth cycle to treat those problems. So coming to hair follicle regeneration. So hair regeneration basically relies on the hair follicle stem cells which are present in the bulge region, which activate during the phase or the growth phase, which they activate upon receiving signals from the specific type of cells called the dermal papilla. So the dermal papilla is basically signaling the hair follicle stem cells. So, and this is helping, to activate the growth phase. So the hair follicle stem cells, which are normally dormant in the telogen phase, become more triggered, or they start proliferating only when they receive the signals from the dermal papilla. So what are these dermal papilla secreting? They are secreting certain growth factors or cell signaling molecules such as Wnt molecule, fibroblast growth factors, and sonic hedgehog molecules to stimulate the growth. And while certain molecules like BMP, bone morphogenetic protein, helps to maintain the quiescence of the cells. So based on the production of these molecules, the dermal papillae can control what the hair follicle stem cells need to do. So if you're looking at the Wnt beta-catenin pathway, this will help to drive the hair follicle stem cell activation, and its suppression can lead to hair thinning. So if you want to help in hair regrowth, you might have to help in boosting this Wnt beta-catenin pathway. So thereby the hair thinning can reduce. So other molecule like your BMP helps to keep the hair follicle stem cells inactive. So let's say if you're not blocking it with molecules like noggin, this will help to promote the regrowth of the hair. And sonic hedgehog, which is essential for follicle development and cycle restart. So you can also look at regenerative strategies by addressing these pathways and help to promote the hair regeneration. So therapies like minoxidil, which is a Wnt stimulator, so this can help to regenerate the hair growth. PRP, platelet-rich plasma, so this is basically very rich in growth factors, and this can be used for therapy too. And the growth factors that are present in the enriched plasma will basically help in the hair regeneration. You also have JAK inhibitors, which can also help in boosting the hair growth and thereby reactivate the follicle stem cells. So, if you're looking at stem cell transplants, so they basically aim to restore the hair growth by replenishing or reactivating the hair follicle stem cells and the dermal papillae stem cells, which generally weaken with age or androgenetic alopecia. So, how does this generally work? The first, extract the hair follicle stem cells. So, in this case, the stem cells are harvested from patients' healthy follicles. Let's say this is generally taken usually from the occipital scalp. Once these stem cells are extracted, they can be reimplanted into the regions where the hair is thinning, or let's say balding is experienced. So in those regions these stem cells can be implanted back after expansion. So once the stem cells are taken, lab expansion is generally needed. So lab expansion wherein the cells that are extracted or are multiplied and sometimes reprogrammed into dermal papillae like cells. In many cases you can just grow and expand the population of cells that you have, because the stem cells that you get are very less in population, or less in number. So when you are growing them, you in a culture medium, or under certain incubator conditions, you can expand the population of cells. And in certain cases you can also use normal cells and you can reprogram them to become the dermal papillae like cells. You might need to use certain growth factors and reprogram them. And you can use transplantation, wherein activated stem cells or DP cells are injected into the balding areas. This will help to stimulate new follicle formation, or it can also revive the dormant follicles or the resting follicles. First step is your extraction, then lab expansion, and then cells that you have expanded and reprogrammed, you're going to introduce them into the balding regions to help in stimulating the old dormant follicles, or it can even help to stimulate new follicle formation. So what are the types of stem cell therapies that are available? So you have autologous hair follicle stem cell transplants. So this uses the patient's own hair follicle stem cells to regenerate the new follicles, because you're using your own cells, possibility to avoid immune rejection. There is currently Japan's hair follicle cloning, and this basically shows around 80% success in the early studies. You have induced pluripotent stem cells. So the induced pluripotent stem cells are reprogrammed skin cells which have turned into the hair follicle stem cells. These are cells that are abundant in the adults. So what they would do is they will extract these cells, and as I told you, you can add some growth factors and give certain specific conditions, and you can program these cells into the hair follicle stem cells. When is this done? Usually when the existing stem cells that are in the person, it is very less in number, or the quality of the stem cells from the hair follicle is not good. We can use these adult cells and you can induce them to become stem cells. You can also look at mesenchymal stem cells. So these are usually taken from fat tissue. So these secrete growth factors to support follicle health. Any of these kind of stem cells can be used for the therapy. So other therapies involve 3D bioprinting of the follicles. You can use layers of stem cells and biomaterials to create an implantable hair follicles. But this technique is generally not scalable, but it shows that at lab level you can find that the cells are showing viability. So basically you're going to print out layers of biomaterials and stem cells to create like an artificial hair follicle. You're trying to mimic the condition of a normal hair follicle. Stem cells are able to remain viable, and they're able to show good growth. But to produce at an industrial level, it is generally very difficult. And you can also use exotherm therapy, wherein you're injecting nanovesicles from stem cells, which will help to rejuvenate the dermal papillae cells and the hair follicle stem cells. This is used in platelet rich plasma, and also in treatment with reduced shedding of the hair that is noticed. So they are going to extract the plasma from a person, and they are going to enrich the or concentrate the platelets from your own blood, and this is injected into the scalp, which will help to stimulate the follicles via growth factors such as vascular endothelial growth factor, fibroblast growth factor, and platelet derived growth factors. So these are some of the therapies that can be used to help regeneration process. So we'll be ending this part of the session. We'll continue in the next session. Thank you.